Good morning. Today lecture is about tooth mobility. What are types of tooth mobility? For knowing the types of tooth mobility, we have to define mobility itself. Mobility is loosening of a tooth in its socket, and it is of two types. We have physiological and pathological mobility. Physiological mobility, it means to refer to a large or moderate force exerted on a crown of a tooth surrounded by a healthy and intact periodontium. This is a very important point. The physiological mobility, there is healthy and intact periodontium. And the tooth will show tipping movement or it will tip within its alveolus until a closer contact has been established between the root and marginal or apical bony tissue. All teeth have a slight degree of physiological mobility. This is different between the teeth according to the teeth, number of the roots, also according to the time differences during the day. It is greatest in the morning and with time decrease progressively. And during the waking hours, mobility is reduced due to chewing and swallowing forces, which intrude the tooth in its socket. Also, this mobility is less marked in a person with a healthy periodontium than in those with occlusal habits as a paroxysm and clenching. So this is a very important point. We should notice that the physiological mobility decreases with time. Also, it is increased in persons with paroxysm and in clinchers. In this X-ray, we can see there is widening of the periodontal ligament. This tooth has a normal periodontium, but we can see widening of the periodontal ligament. This may be a sign of increased tooth mobility due to many reasons. Now we are going to talk about pathological mobility, which is a progressive increasing in tooth mobility, which may occur in conjunction with trauma from occlusion, and it is characterized by active bone resorption, which is indicate the presence of inflammatory process, and there is an inflammatory alteration within the periodontal ligament tissue. Tooth mobility could be in horizontal or vertical direction. Horizontal tooth mobility is the ability to move the tooth in a facial-lingual direction within its socket, and it is assessed by putting the handle of two dental instruments on either side of the tooth and applying altering movement. This moderate pressure will be altered on the facial-lingual direction against the tooth, first with one, then with the other instrument handle. While vertical tooth mobility is the ability to depress the tooth in its socket, and this is assisted by using the end of any dental instrument to exert a pressure against the occlusal or the incisal surface of the tooth. What are the causes of tooth mobility? Causes of tooth mobility. First, advanced periodontal disease and loss of supporting bone. 2. Gingival and periodontal inflammation. Sometimes a patient comes with severe gingivitis or periodontitis. We can notice the tooth mobility. 3. Traumatic occlusion. Any trauma from occlusion could cause tooth mobility. 4. Immediately following periodontal therapy. Sometimes the patients come after surgical periodontal therapy. They came to your clinic and they are complaining from tooth mobility. This is normal. You should assure the patient about this. 5. Pulpal inflammation. The pulpal inflammation also could cause tooth mobility. And in this case, you should test the vitality of the teeth and know if there is a caries in this tooth to differentiate this from other reasons. Factors that govern tooth mobility in a horizontal direction. First, the width of the periodontal ligament space, which is normal about 0.25 mm determined by the X-ray. 2. The height of the alveolar bone, which is about 1 mm apical to the cemento enamel junction. 3. Number of the roots. The multi-rooted teeth are less subjected to mobility than a single root tooth. 4. The shape of the roots. Short tapered shape root is more susceptible to mobility than normal size and wide roots. 5. The degree and duration of the applied force, whether it is normal or abnormal function.